I've been presenting today about how important informatics is for clinical professions, including nursing, but also to talk a little bit about the cultural gap between informatics professionals and clinicians and how important it is that we move those tribes closer together and work in better partnership for a better effect for patients. I think we need to move to more partnership working between informatics people and clinicians where there is more mutual respect and value placed on either group from the other, because actually that leads to a better project outcome, implementation outcome, better product, better everything really. I think informatics is becoming increasingly more important and increasingly understood by nursing professionals, and they're starting to grasp the agenda, they're starting to see that it has significance and relevance in 2014. I often hear from technologists that nurses are difficult to engage and they don't want to change and they're difficult to persuade to adopt technology, and actually I don't agree with that. I've never yet met a nurse who isn't interested in improving things for patients. I just think that perhaps we need to change the content of the conversation so that there's better understanding. I think nurses are enthused and want to adopt new technology, and I think for the first time in the years that I've worked in informatics, I think we're starting to see proper leadership from the top that is leading us to better adoption and technology as a solution for nursing practice for the future. What's changing, I think, is that a number of things are starting to line up together. So we're obviously seeing a change in the available technology. So mobile working is critical for nursing, and the ability to work using technology while moving around is one of the critical things I think that's changing our approach to technology. But equally, the importance of information. So I see informatics as being about information really. The way we create information and the products that we use to do that are secondary. It's the information that has the power. Information drives safety. We don't know whether we're giving safe services unless we've got information to tell us how we're doing. So a number of things are becoming more important and more significant, and I think those things are starting to line up together to give us more momentum. I think events like Health Insights are critical to have healthy conversations and healthy debates, and I don't mean within tribes, I mean across tribes. I think these are great events to have stimulating conversations that lead to better places. And that happens for me when there are informatics specialists of all types, nurses and managers in rooms together, and this is a great way to do it.